Good morning, everybody. Good morning. Good morning, good morning, good morning. You're welcome to today's antenatal class. My name is Obi-Nwabugor Kate. I'm a nurse midwife. You're welcome to today's class. Abosede, you are welcome. Esther, you're welcome. Onome, you're welcome to today's class. Thank you for joining me. Mrs. Adele, you're welcome. Yemi, you're welcome. Fasasi, you are welcome. Thank you for joining. Thank you very much for joining. So please, as we go on with this class today, I want to beg us, if in the course of the teaching you have a question, do well to jot them down. At the end of the teaching, we have a question and answer section. Okay, thank you. So our topic today is the breast in pregnancy, types of nipple, and getting the nipple ready for breastfeeding. The breast in pregnancy, types of nipple, and getting the nipple ready for breastfeeding. Of course, during pregnancy, breast changes are just normal part of it. Breast changes are normal parts. Can we all hear me?
Yes.
Can we all hear me?
Yes, Sister Obi, we can hear you.
All right, thank you very much. So as I was saying, let's do well to mute our microphones, please. Thank you very much. Okay, so as I was saying, breast changes are normal part of pregnancy. And these changes occur as a result of hormonal increase in the body during pregnancy. Of course, during pregnancy, there is upsurge of hormones, which is estrogen and progesterone. These hormones are what helps to, maintain and keep this pregnancy to term. Okay, so it is these hormones also, the increase in these hormones, that brings about these changes in the breast that we'll be talking about today. Okay, breast changes can occur as early as first week following conception and can continue up till delivery and even beyond. Please, let's mute our microphones, please. Let's do it to mute it. Thank you very much. Okay, so these changes we are talking about can occur, like I said before, as early as first week or even second week following pregnancy, and it continues all through pregnancy and beyond. But even as we talk about this, it is important to note that the symptoms we'll be discussing today, every woman experiences it in different dimensions. The breast changes we'll be discussing today varies from woman to woman. So the symptoms we'll be discussing today, it's possible you might not have all of them, or even if you have all, it could be in a minimal level, while for some other persons, it can actually be severe. Okay. All right. So one of the symptoms in pregnancy, early pregnancy especially, I want to talk about the first trimester now. One of the symptoms is breast enlargement. There's usually enlargement of the breast during pregnancy. What brings about this enlargement? Like we said earlier, during pregnancy, there is increased hormonal level in the body. Okay, this is just the body's way of preparing the breast for the task ahead, which is lactation and breastfeeding. And again, during pregnancy, there is increased blood supply to the breast. This is just to help prepare the milk ducts and even the mammary gland for lactation. Okay, so this will also bring about increase in fatty tissues in the breast. So this will bring about the enlargement of the breast. Okay, then there's increased blood flow to the breast, and of course there's increased hormone level acting already on the breast tissues, the ducts, and the mammary glands. So there is bound to be an increase in the size of the breast. Then this increase we are talking about can be up to a size of a cup and even more. And this increase is more obvious for first-time mothers, okay? It might not be very, very obvious for multigravidas. When I say multigravida, I mean mothers that have given birth multiple times. But for first-timers, this enlargement in the breast size is very, very obvious. Okay, so we'll talk about tenderness and discomfort in the breast also. During pregnancy, the breast becomes enlarged, and of course, it becomes tender. There's no other thing that causes this than the increase in the hormone that we talked about before. Now there's increase in hormonal level, there's the breast tissues increases, there is also an increased supply to this breast. So the breast becomes tender and can even be painful to touch. Okay, it's one of the early symptoms of pregnancy also. Then the woman also may have sore nipples. Then the breast feels heavy. There could be this tingling sensation in the breast. Of course, the tingling sensation in the breast can be as a result of when the breast is enlarged, the skin of the breast also is stretched, okay? So that's what can bring about this tingling sensation in the breast. And the nipple may also feel sensitive and even painful to touch during this time. But this discomfort can actually subside. It can subside after a few weeks and may also reappear in the later stage of pregnancy. Then we'll talk about blue veins. Yes, because there is already enlargement, and of course, there is increased demand of blood supply to the breast. The veins in the breast also gets dilated in order to accommodate this increased volume of blood that's being supplied to the breast now. So that brings about, this can actually make you feel, or rather, this can make you see these blue veins, on the breast. They become visible. When you see such, it shouldn't be a source of concern or cause for alarm, because it is actually because of the demand of supply of blood to that part of the body, which is the breast. And the vein does not have a choice than to accommodate that increased blood that's being supplied to the breast. And this can bring about visualization of these veins. You see some lines on the breast, you see some veins, they become visible, which on a norm, they were not like that before you got pregnant. So it's actually one of the changes that can occur during pregnancy. Then we want to talk about the nipple itself and the areola. What change occurs in the nipple and the areola? When I say areola, it means that darkened area that surrounds the nipple, okay? That darkened part that surrounds the nipple, that's the areola. You notice that the areola gets darkened, more darkened. They call it secondary areola. It is not a source of concern. It's just the breast preparing itself for the task ahead. And also the nipple gets more, erectile and more sensitive in this time. You see, for those persons that you see that the nipple gets more, protrudes more and gets more centralized in this period of pregnancy. And also there could be bumps. Let me use that word bumps. It's actually called Montgomery's tubercle, okay? This tubercle, it can appear like bumps on the areola, which is that dark part that surrounds the nipple. So these things the Montgomery's tubercle can now appear more on the areola during pregnancy. These things are good. Why? Because they produce lubricants that lubricates the nipple and the areola during pregnancy. And this will help to prevent dryness and prevent cracked nipple, and then reduce the discomfort we talked about before now. Okay, and also during pregnancy, the nipple may leak colostrum, like colostrum can seep out of the nipple during pregnancy, especially during the second and the third trimester. When this happens, it shouldn't be a source of concern. Colostrum is actually that first yellowish milk. Okay, let me call it a yellow colored milk, yes, that the mother produces, few days following delivery. Okay, so this thing can actually start happening even in second and third trimester before you deliver. When you experience this, like I said before, every woman, it varies in every woman. Some people may experience it while some other persons may not. But in case you are in that category that experiences colostrum seeping out of the breast in your second or third trimester, please don't fear. It's just so normal and it's part of the changes that occurs during pregnancy. Okay, so having said that, want to talk about the types of nipple. The types of nipple. Yes. So one of them is a protruding nipple. How do you know a nipple that is protruded? How do you know? They are usually raised a few millimeters away, or rather above the areola. What do I mean? When you do a pinch test, like when you compress, you don't in a protruding nipple self, you don't need to compress it. You can just see it protruded there, and it's a few millimeters above the surrounded darkened part, which is the areola. So in that kind of nipple, it does not pose challenge during breastfeeding because, of course, it is protruded and is very, very okay. Then we'll talk about flat nipples. When we say flat nipple, there is no difference between the nipple and the areola. The nipple is as flat as the level of the areola. Yes, it is not protruded, it is just there at the level of the areola. And how do you know that, okay, this is a flat nipple? When you do a pinch test, how do you do a pinch test? With your finger, you gently compress the areola, which is that darkened part. On a norm, when you compress the areola, the nipple is supposed to protrude out. But in this case of a flat nipple, when you compress the areola, the nipple remains at the level of the areola. The nipple remains at the level of the areola. But you will see that the spot of the nipple can just be hardened to denote that, oh, this is the point of the nipple, but it is very, very flat. Then another type of nipple is the inverted nipple. The inverted nipple. Now, in case of inverted nipple, instead of the nipple protruding out and pointing outward, this nipple points inward. Yes, it points inward. So even when you do a pinch test, like compressing the areola, the nipple points inward. Yes, just as the name implies, it inverts inward instead of protruding out. That is another type of nipple too. Then we also have a large nipple, like two large nipples. When I say two large nipple, the nipple can be as large as bigger than the mouth of a newborn baby. Yes, we have nipples like that too. Then also we have the unilateral inverted nipple. When I say unilateral inverted nipple, one side of the nipple is well protruded and outward, facing outward, while the other one is inverted. That means is facing inward. So in this type, one breast is carrying a normal nipple that is looking outward, then the other one is carrying another nipple that's looking inward. Yes, it happens, and there are people that has it too. Yes, and there are also people that has this hairy nipple. Yes, you see surrounding their nipple, you see hair everywhere. It's just so like that with some people too. There are people that has hairy nipple too. So these types of nipple that we have discussed, how do we prepare them? for lactation, or rather for breastfeeding. We have discussed various types of nipples. How do we prepare them for breastfeeding during pregnancy? Now, for someone that has too large nipples, let me start from there. Well, you need not to do anything to the nipple in terms of bringing it out. One thing is this: during breastfeeding, the nipple is already out and protruding. So bringing out the nipple is not a challenge now. The nipple is already out. But the challenge is, after delivery, the baby might not be able to latch very well on it at the initial stage. With time, baby is definitely going to get used to this nipple and know how to feed well on it. But for preterms, when are premature babies, they might not be able to feed on this too large nipple. But for term babies, that means babies that are born at term, they were not born before time, they were born at term. It might be difficult at the initial stage, but with time, the baby devises a means of coping with this large nipple, and baby is able to feed with that nipple the way it is. Fine. But that first time, when the baby is not able to cope, we can do well to express milk for this baby. And also, we shouldn't stop putting baby to breast, because it is by constant putting this baby to breast that baby will be able to develop or devise a means to cope with this large nipple and feed very well on it. Then, how do we manage flat nipples? For those persons that have flat nipple, how do we prepare them for lactation? So what you do is you do a massage. What do I mean a massage? First of all, you wash your nipple with plain water. Anyways, we'll come to care of the breast and the nipple, but like how to manage them during pregnancy, how to care for them. We'll come to that discussion. But how do you prepare this flat nipple first? During pregnancy for lactation. Now, when you massage, you can wash the nipple, then you apply a lotion. What lotion am I talking? A lubricant. You can use olive oil, okay? Then you gently roll the areola part and the nipple, then you pull out. You pull out the nipple. As you pull out, you do this on a regular basis. This will help to bring out the nipple. Also, you can use nipple former. There's this metallic, how do I call it now? Is a nipple former. You wear it over the nipple. Yes, it helps to trap the nipple together and help you to pull it out during pregnancy. This nipple former can be worn like an hour in a day. Like at that time you are just starting, you can wear it for an hour in a day. Then you can gradually proceed to wearing it to up to 8 hours in a day. And also for those persons that have flat nipples, you can use nipple shield. This nipple shield is a piece of silicone that is designed, and it has the shape of the areola and the nipple. You can wear it over the nipple, and this can also help you to pull it out, pull the nipple out. You should practice this on a daily basis. And also for people that has inverted nipple, this same method applies to you. Yes, always do this massage and pulling out of the nipple. You can apply olive oil, you can use coconut oil. Well, you can use those two to massage the breast, the nipple area, then try pulling it out. Try pulling it out in a gentle manner. This will help us to bring out the nipple to some extent so that our baby will be able to latch well. Then, how do we care for this breast? The breast and the nipple, because they go together. How do we care for them during pregnancy? How do we care for them during pregnancy? Now, get a right size bra. Of course, during pregnancy, the breast is already enlarged and is still growing. So we may need to change a size or few bra during this time. And we encourage us to choose a cotton bra. So it gives room for the breast to breathe, not a condom bra. Please, very, very important. Let's choose a cotton bra and a firm bra to provide that support we need so as to avoid backache. For some persons that are really busty, this breast grows really big. And when this happens, you need a firm bra with a good strapping, not a very tiny, so it can give you that firm support on the breast. Then don't wear too tight bra during this time. Not a too tight bra. Reason being that too tight bra can hamper milk production by blocking. Can we please mute our microphones? Thank you. Okay, too tight bra can hamper milk production and also block the milk duct. And this wouldn't be good enough. Look for a bra that will offer you that good back support. Not a very tiny strapping that everything will be dangling. This can also cause you discomfort. Then massage the breast on daily basis. How do you do that? Remember, the nipple may crack during this time because the nipple everywhere is already fragile because of this hormone that's acting on every part of the body during this pregnancy. So the nipple may crack during this time. So what do we do? It is important to retain moisture around the nipple. And we can do this by using, I said it before, we can do this by using olive oil to rub and massage gently around the breast and the nipple. And also when you do this, by massaging and pulling out, the inverted or flat nipple tends to come out better before the arrival of the baby. Then massaging this breast also improves blood supply, circulation to the breast. And this will give us a healthy milk production and a healthy breast also. Then maintain good hygiene. How do you maintain good hygiene? Please, regular washing of the breast and the nipple. They have to be kept clean at all times. Remember, I said it before that one of the changes that occurs in the breast during pregnancy is that colostrum may seep out of the nipple. And remember, if you don't care for the nipple, if you don't wash this place, the colostrum can dry up there and form crust on the nipple. And this can cause dryness and lead to cracks on the nipple, which will cause you, the mother, discomfort. And when the baby eventually comes, you will not be able to feed this baby very well. So it is important that you change your bra and avoid the nipple being too wet. If you are the type that your nipple seeps colostrum, like colostrum seeps out of your nipple, do well to wear a bra, a pad, breast pad. This breast pad will help you to mop up those colostrum that comes out. Then it will avoid the nipple from being too wet, because if it is too wet, that colostrum remains there for a long time. It can actually cause infection and also cause soreness to the nipple. So when you wear this pad, it will help to, absorb the colostrum that's coming out of the breast and keep the nipple also dry. Then do not use soap on your nipple or any drying agent. I've seen cases where mothers will go and use spirits because they are trying to be very clean. You see mothers using spirits to clean their areola. Like I told us earlier, that darkened part is part of the changes that occurs in pregnancy. So it is not that you are dirty or something is wrong with the breast. It's just a normal thing. But I've seen mothers, they go and use spirit and cotton wool to clean it, or are they sterilizing it or what? I don't know what to call that. But that's actually a drying agent. Remember, when you use spirit to clean, it evaporates and leaves the nipple dry, and this can cause cracks on the nipple. So please, let's try to, on no account should we use any drying agent to clean the nipple. And also we shouldn't use soap, but instead we should use just plain water to clean the nipple. Plain water is okay to clean the nipple. And thereafter, if you still feel dryness, you can apply moisturizers. Or better still, you can just use olive oil and you are good. But if you want to look for other lubricants or ointments, you can go for vitamin A or vitamin D ointment. You can just rub on the nipple. And again, in caring for the nipple, we should choose a well-fitted dress. Remember, the nipple is already fragile at this point. So when you wear a cloth that is not well-fitted, and maybe you're not putting on bra, and you take a long walk, of course, in the course of that long walk, the clothes will rub on the nipple, and because the nipple is already fragile, that can cause soreness on the nipple. It can cause sore on the nipple. So please, let's try and ensure that we choose a well-fitted dress. And for people that have colostrum seeping out, do wear to wear breast pad, and also change your bra regularly. It's just a way of maintaining hygiene, and also will have a good outcome. Then, okay, we've said we should wash the nipple with only water. We've discussed types of nipple. Then we've talked about how to help ourselves in cases of those that have flat nipple or inverted nipple. Yes, and those of us also that has unilateral nipple, we've talked of how we can take care of that when one is protruded and the other one is inverted. We've also discussed that. And for those of us that have hairy nipple, yes, lest I forget. For those of us that have hairy nipple, because I've seen women that has hair around their nipple, this is real, it's no jokes. So how do we care for hairy nipple? Please, for us to breastfeed our baby well, because of course, let's do well to take those hair away. Like, let's shave off those hair, because as we all know, hair traps germs. Okay, hair traps germs. So when you leave those hair there, it's going to feed you. Your baby is invariably going to be feeding on germs. So let's do well to shave off hairs around our nipple before we feed our baby, and ensure that we keep it clean all through our period of breastfeeding. So at this point, I would like us to ask questions. If you have questions about the changes that occurs in the breast during pregnancy, you have questions about the types of nipple, you have questions on how to care for your nipple and your breast during pregnancy, please ask. Thank you so much for having me. So it's question time. Hello. Hello, house.
We can hear you.
Let's ask our questions. Mothers, new mothers in the house, everybody, let's ask our questions. Hello.
Hello, good morning.
Good morning.
Good morning, ma'am. Hello,
Good
good
morning,
morning.
sir. Hello, sir. Good morning to you. Hello. Hello, everybody. Please ask your questions. It's question time.
Good morning.
Good morning to you.
Okay, please, I have it's not related to breasts. Like I have a concern.
Okay.
I have severe constipation. I can't eat and I can't go to the toilet.
It's a bit noisy there. I can't hear you clearly.
Yes, I'm having severe constipation. This one is
Oh, that place is so noisy.
wow. It's not noisy.
Please, let's mute our microphone. So, who is laughing? Mute your microphone, please. Someone
Please,
wants to
you
ask
can mute
questions.
them. You can mute them.
Okay, ma.
Mute them. Anyone that wants to speak will unmute.
Okay, ma. We are right, participants.
Okay, can you hear me now?
Yes, I can hear you.
Okay, so I'm having severe constipation. And I can't even eat. Breathe very well.
You can't eat.
Yes.
You are pregnant, but you are not able to eat.
Yes, I'm having severe constipation, yeah.
You are having severe constipation
Yes.
and you are not able to eat.
Yes.
Okay, first of all, I want to say that constipation is actually one of the changes that occurs in the gastrointestinal system during pregnancy. Okay, this is because the hormones, which is the estrogen and progesterone, had acted on them also. Okay, so there's a big, can you hear me?
I can hear you very well.
Yes, so the hormones that we talked about had acted on this, on the gastrointestinal system also. So sometimes the motility, the gastrointestinal or peristalsis is slowed. Okay, so it's actually one of the changes that occurs. So what you do in this regard is I encourage you to take enough vegetables and fruits. This will help to soften the stool and you'll be able to pass out stool. And for you not being able to eat, of course, nausea, vomiting, and loss of appetite also can be a change, you know, that a woman experiences also in pregnancy. So what you do?
That one is due to the constipation because the foods are not digesting. So they tend to be in my chest.
Okay, so now that we know that it is the constipation that brought about the loss of appetite, you do well to take plenty of vegetables and fruits, and you'll be able to pass through and also eat well. I hope I answered your question.
Okay, thank you.
You're
Thank you.
welcome.
Hello, Sister Obi.
Yes, ma.
Please let me add this to what you have, the answer you gave her.
Okay, ma.
She said she's not eating well.
Yes.
And that she has constipation.
Yes.
There are two things working against one another. If she's not eating well, whatever is in her GIT will not move.
Yeah.
Yes. If she takes enough fluid and take roughage, like the vegetables, and eat a little more, then the constipation will be relieved despite the hormonal impact on the GIT. So let's encourage her, madam, please, don't go off food completely. Try and take something. If you try and take something, the constipation will be relieved. If you don't take anything, then there is nothing to pass. But if you take something, the constipation will be relieved. Take enough fluid, whether with free water or you take juice. It will help the GIT and you will be able to relieve the constipation. Thank you.
Thank you very much, Chief, for that contribution. Thank you so much, ma.
You're welcome.
Some more questions.
Hello.
Hi, good morning, sir. Good to have you here, sir.
Thank you for the beautiful lectures.
Thank you, sir.
I just want to comment about the colostrum you talked about in the second and third trimesters.
Okay, sir.
It is true that it can occur, and it is normal in pregnancy.
Also, tell our daddies not to stimulate it. Therefore, they should leave the breast alone. When you notice that breast milk is coming before you deliver, then the stimulation of that breast should reduce as much as possible. That will be one way to reduce the breast milk coming out.
Don't breastfeed your husband that time. God bless you.
Thank you, sir. Thank you so much for that contribution. All right, mothers, please ask your questions. Ask us questions about breastfeeding, about your breast. If you have any concern, please share. The floor is open. My MD is here, my chief is here, so just blast us, please. We are waiting.
Excuse me, sister, if one has issue with the nipple, maybe inverted nipple or flat nipple, what can we do after delivery to help to relieve or to encourage breast milk production?
Okay, if someone has flat or inverted nipple after delivery,
how can we assist the baby to breastfeed?
Okay, so after delivery and one has flat or inverted nipple, like I said before, if it is so bad that the baby finds it difficult to latch, we can actually get a breast shield. Okay, this breast shield is a tin of silicone that is designed in the shape of the areola and the nipple. So you wear it over the nipple and the areola. The baby suckles on this breast shield, and this will help the baby to feed. And remember, the breastfeed is perforated in a way that breast milk coming out from the breast, baby can actually get it through the shield because it's perforated. It can actually get to the baby. So if you have that nipple that does not allow you to feed the baby, or the baby doesn't latch well on it, do well to get a breast shield. Baby can suckle on the shield and can also get the milk. And at the same time, you can also express milk. If the baby cannot latch on the nipple because it's so flat or too inverted, baby finds it difficult, you can actually express the breast milk and baby will be fed with the milk. And at the same time, this shouldn't make us stop putting the baby to breast. With the aid of this breast shield, the nipple will come out. It's just a matter of time. And as the baby suckles continuously on the nipple will pull out with time and the baby will be able to suck well. Thank you.
Thank you.
Yes, ma.
Hello.
Hi. Good morning.
Wonderful teaching, well explained. But I have a question in another slide. Breast.
Okay.
It's with the feet, my legs. I'm actually in my second trimester, and I find it very difficult most times to walk. I have this pain in the feet, and then sometimes it swells down, but the pain is the one giving me comfort. How do I manage that till the end of the pregnancy?
Is the feet swollen?
Yes, Yes.
Did you say the feet is swollen?
Yes, it's swollen, but sometimes
Okay.
it comes down. Yes.
Okay. Sometimes it comes down. And
Yes,
this
ma'am.
pain is usually more when the feet is swollen, right?
No, even when the feet is not swollen, at the ankle level,
Okay.
that joint, then before the fingers,
Okay.
the pain is much painful. When I'm walking, I usually lean because of the pain. I don't know, maybe I feel like the weight is too much on the leg or so.
Okay. Okay, so like you just said, during pregnancy, there is increased weight also. Okay, there is increased weight. The increased weight tends to exert pressure more on the lower part of the body. That is when, and also there is reduced venous return. So fluid is trapped at the lower part of the body. That is why you see that most women, or rather some women, will have swollen feet. And when this feet is swollen, of course, the skin in that area is stretched. The tissues are stretched. And the woman is bound to have pain. This pain can actually be a bearable one, like it can just be a dull pain there. While for some other persons, it can be exaggerated. And that's why we encourage that a woman with a swollen feet, or rather a pregnant woman that's having this swollen, always elevate the feet whenever you are seated. And also when you are lying down, use one pillow to elevate the feet. So that there will be good venous return to the heart and thereby reduce the edema.
No,
And
it's better.
also,
I like to use it.
okay, and also we encourage that woman that is pregnant, because of course you're already pregnant, the weight has increased. You are carrying a full human being in you. Of course, when you check your weight on the scale too, you could see the difference between the weight you have presently that you are pregnant and what your weight was before you got pregnant. So there's already weight above that. That's why we encourage that pregnant women should not stand for a too long time, because standing for too long time will exert pressure on the lower limbs, like I said before, and also there won't be enough venous return back to the heart. And also fluid will be trapped at that lower part of the body, bringing about this edema, and that swelling will bring about stretching of the tissues and the skin, which could lead to pain in that part. And you see that when it is being elevated, it encourages venous return and this swelling tends to subside. So regarding your complaint, it is obvious that the pressure from the weight there on the lower limb is what is causing you pain. So for the few time, you already say you are in your second trimester. So for the few time remaining, just try to manage yourself by way of not standing too long, by way of elevating your feet whenever you are sitting down, and also when you are sleeping, by way of elevating your feet with pillow. I think, and also always massage these feet. Massage your feet. Someone can help you do that. Let them help you to do a gentle massage on these feet. This can help to provide a soothing effect and also bring about relief from the pain you are experiencing. I hope these points I made helps you. And
Yes,
if
thank you so
pain
much. Mm.
continues, please do well to see your doctor. Thank you very much. I hope I've been
Yes,
able
ma'am.
to answer your question.
Yes, ma'am. Thank you so much.
You're welcome. You're welcome. Oh yeah, more questions.
Good morning.
Good morning to you.
I'm sorry. The question I want to ask is not related to the breast.
Okay.
Okay, so I sleeping and I turn to the right. Of course, I don't do that swiftly. I take my time to do that. Every time I do that, I notice that I begin to I'm very, very uncomfortable when I sleep on my right. And that, before you know it, I'll start having a burning sensation in my chest. It's either of course, I'm going to get up, sit down for a while. And most of the time, until I throw up, before I will be relieved. I don't know what's causing that.
Okay. So burning sensation this happens more when you lie on your left.
On my right, when I turn to the right.
Yes. Okay, when you turn to the right, yes, that is when you experience this burning sensation. And most times until you throw up, you don't feel relieved.
Yeah.
Okay, so first of all, regarding the position, I will urge you to please assume the comfortable position for you. Okay. Then for the case of burning sensation in the chest and vomiting, yes, it's also a change in pregnancy, okay? Because these hormones, okay, first of all, during pregnancy, as the pregnancy progresses, the fetus grows and the uterus increases in size, okay? So before pregnancy, your uterus is in the pelvic region, okay? But when you got pregnant, as the pregnancy grows, the uterus grows out of the pelvis and gets into the abdomen. Let me say the tummy now in a layman's language. Now, it is in this tummy that you have your stomach. It is in this tummy that your stomach is, and your stomach is where your food is stored, okay? Now, there is what we call the cardiac sphincter. It is this sphincter that, when we swallow food, it is this sphincter that closes in order to hold that food we swallowed in our stomach. Now, during pregnancy, this estrogen and progesterone also acts on that sphincter because, of course, it acts on every part of our body. Still in the gastrointestinal tract, it acts on this sphincter, and this sphincter gets somewhat weakened. Okay, so when we eat, there's usually gastric reflux, like should I call that regurgitation of food or so? Then this is what brings about this burning sensation in the chest that pregnant woman feels. Okay, that is why until you throw up, when you throw up, you get out that food that was regurgitated or that escaped through that sphincter and cause you that burning sensation. So when you throw up, the food is off that place, and then the whole symptom subsides. So first of all, because you already know the cause of this whole thing, that it happens when you lie on your right side, please do well to always be on the side that does not cause you discomfort. And for the idea of burning...
I'm sorry, but I can't lie on my right or my left all through the night.
All through the night.
I can't lie on my left or through the right. I have to, turn, because I noticed that I tried to lie on my left for a long time, but when I do that, I feel pain around my hip area for a while. So I have to, turn. That's the only time I make that turn. And every time I make that turn, I feel this way, and I don't know.
Okay. So please, while lying on that left, let me tell you what to do also if you are lying on that left. Please do well to support your tummy.
Yes.
I have a pregnancy pillow. I have all of that. I have that.
Okay, that you use to support yourself.
Yes, I do. I have that.
Okay. So when you want to turn to that side, the right side, I urge you also to use a pillow to kind of elevate your head. Okay? Elevate your head so that reflux will not come. When your head is elevated, it won't come. Or rather, if at all it has to come, it won't be as much as it used to. So when you want to lie on your right, do well to elevate your head on your right.
Okay.
When you want to lie on your right, do well to elevate your head so as to prevent this regurgitation and heartburn.
Hello.
Okay.
Hello.
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 Hello. Yes.
Yes, ma.
Sister, let me add this to our sister. How many weeks is she?
22.
Eh?
I'm 22. 22 weeks.
22 weeks.
Yes.
Okay. And you are very big in your tummy.
Well, normal size. I'm a slim person, not very big as such.
Okay. You know what I will advise you to do is don't eat late.
I try not to. I try to eat before.
When do you have your last meal?
Sometimes 6, 7.
Okay. If you have to or need to take anything late, please take beverage or fruit.
L'Oreal, you are not around.
You said? Are you listening?
Yes, ma. I'm listening to you, ma.
Yes, there's so much background noise. If you have to take anything late after your dinner around 6 o'clock, then take fruit or take beverage. When you do that, you sleep comfortably in any position, and then you will not have the risk of regurgitating.
Okay, ma.
Yes. Thank you.
Thank you, ma.
Thank you very much, sis.
Yeah.
Thank you so much. Okay,
You're
someone
welcome.
dropped a message here. The person said, good morning. You said we should change our bra regularly. I work from home now and I don't go out and I don't usually wear bra. Hope this is not a problem. I hope this is not a problem. That was a question from one of our participants. Well, it is not a problem if you don't wear bra and you feel comfortable. Okay? If you don't wear bra and you feel comfortable, it's not a problem. But the thing is this, if, like I said before, remember your clothing, the nipple is already fragile at this point. It's already fragile. But if you don't wear bra and you are comfortable, it's not a problem. If you don't wear bra, but hygiene is maintained, you feel comfortable like that, no, it's fine. There's no problem there. There's no problem.
Excuse me, sister, the only problem she can have, you know, the breast is now big. She can have discomfort of sagging. And then if she doesn't want her breast to sag, then it's better for her. If she cannot wear bra, she should wear bra top. Something to relieve the weight of the breast. Yes.
Okay. Thank you so much, ma. So I hope you got the explanation, madam.
Please, people should try and mute their minds.
Mute everybody. The noise is never allowing anybody to hear. I think you should just mute everybody.
Oh, I did that already. Okay. I did that already. So anybody that wants to speak should please unmute and speak. Okay, someone said, good morning. Hello, can we hear me? There's a question here. Someone said, good morning. I didn't really get what the doctor said about the breast, colostrum, and husband sucking the breast. Please, can you explain? Okay, so what he said was that when colostrum seeps out of the breast in the 2nd or 3rd trimester of pregnancy, the stimulation of that breast should be minimized. The breast should not be stimulated at all, so as to reduce seeping out of this colostrum. That was what he said. And he also said that don't breastfeed our husbands at this time. Of course, we shouldn't, he said we should not breastfeed our husbands at this time that the breast is already bringing out milk. So we shouldn't stimulate the breast again. That was what he said. I hope you get that, ma.
Mother and child, don't she run?
Hello,
Okay.
good morning.
Good
Hello,
morning to you. Yes, I can hear you.
Yeah, this is Mrs. Anike.
Okay.
Sorry, I want to ask
Welcome.
about the heartburn. About the
Okay.
heartburn. Because I've been
Yeah.
having it seriously, like especially like last month. So a friend of mine told me about the use of antacid. So I should
Okay.
buy Gatorade or maybe a glycol, a big glycol, something
That's
like that.
cool.
That's cool, exactly. So what do you have to say about the use of that? Like, is there any effect on the baby on using that? Because I've already started using it, so I don't know.
Thank you so much for the question. First of all, I would like to let you know that self-medication is very, very wrong for you.
Mm-hmm.
Yes, this is because it is not just about you at this point, but also the baby. So please, before any medication is used, it should be prescribed by your doctor. Use drugs when your gynecologist when your gynecologist says you should do so. Please, very, very important. Let us stop self-medication. It is not good at all. Then for the heartburn, there are other ways we can actually manage it. Just like my matron said before, don't eat late at night. Also, eat small frequent meals. There are some persons, it is when they eat a very large meal that they experience this. So we encourage that you eat small frequent meals, take copious amount of fluid, because like I said before, it is because one of the changes that occurs during pregnancy. So it is not out of place. So whatever you are doing at this point is just like a palliative management, because it is something that will go off after delivery, because everything will return to normal. So please, if you are having heartburn, there are basic managements, which I just said: small frequent meals, don't eat late at night, take copious amount of fluid. Okay, when you eat, don't just lie down immediately you eat. Give yourself some time before you lie down after eating. And if there is need for you to use any medication, your gynecologist will determine that. So please see your doctor. If the pain is so exaggerated that you need to use something, please don't just self-medicate. It is not a good practice for you and your baby, please. So that is it. You can come in with the drug so that your doctor can assess you and know if you should use any antacid or you can just continue with our normal palliative management. Thank you very, very much.
So I have a last question. This is like a personal stuff here. Because anytime I come for antenatal, I usually forget. Please, I'm using HMO. I'm using Anzamazat. And all my friends that are pregnant like me, this is my 32 weeks. They've not given me hospital list. So I don't
They've
know
not
if
given you what?
Hospital list. That if there's
Hospital
anything.
list.
Hospital list.
That's
So I
not
don't
a
know.
challenge at all. Please, when next you come in, please, at that point where they do your vitals, please just request for the list. They will give it to you there.
Thank you, ma'am.
It's not a challenge at all. Please, when next you walk in, just tell the nurse at the vital sign station that you need the list. She will just give it to you. She has it there.
Okay, no problem. Thank you.
Yeah. All right. Thank you very much.
You're welcome.
Okay, so someone said, please, I want to ask. She said, good morning. Please, I want to ask, what could cause pain around the pelvic girdle for a second trimester person? And this is my first pregnancy. All right. Pain in the pelvic region is actually a normal thing or one of the changes that occurs during pregnancy, okay? So during pregnancy, there are ligaments. There are ligaments that hold the uterus in position. Okay, we have the broad ligament, round ligaments, and all that. I wouldn't be going in details into all that. So we have ligaments that hold the uterus in position. So during pregnancy, these hormones act on them also, and they get a little weakened. That is why you experience that pain. They call it ligament pain. It's actually ligament pain you are experiencing. And sometimes when you are walking, you could feel some persons will tell you that, oh, my hip has shifted. Oh. Your hip did not shift. It's actually the pain from the ligament, because of course the hormones have acted on them and they are weakened, and also there's pressure pulling on them from the weight of the uterus that is containing the baby. So that is what brings about that pain. So sorry about that. Just relax. It's just a matter of time. You get over all that. I hope you got my explanation. Okay, so someone said, but the doctor, the gynecologist at the hospital recommended that antacid for me. Oh, not the gynecologist, I mean. If, like I said before, if you need a medication and it is determined by your doctor, please go ahead and use. The one I kick seriously against is self-medication, going to get drugs for yourself. Like I said before, this is simply because it is not just about you, but about you and the baby. So please, no self-medication. Stop self-medication. It is wrong. Is there anything one can do to prevent having preeclampsia? It occurred in first pregnancy. At some point, it became severe and it led to CS. Okay, so in this case, this is why you have to consult with your doctor at all times. Now, if you had this history, it is good for you to come to the hospital, and when you are seeing the doctor, do not hold any information, because the information you provide to your doctor or your healthcare provider gives them a guide on the best way to care for you. So please, if you had such history, please don't hesitate to come for your follow-up, and also do whatever instruction that is given to you by your doctor. This will help. This will really help. Thank you very much. All right, more questions, please. First-time mothers in the house. Yes, multi-gravidas in the house also that ask questions. Please do where to ask. Ask your questions. Ask your question. Okay, she said, how can I manage the pelvic girdle pain? Yes, how you manage the pain? Okay, so make sure you rest very well. Very, very important. You need rest. Then you can massage the area. You can massage the area to provide a soothing effect and also provide relief for that point. And if the pain is so unbearable, you can see your doctor, and the best pain relieving drug for you will be given to you. That is it. Then exercises also can help to keep you fit. Please, exercises. Let's always exercise. Very, very important. Let's exercise.
Hi, good morning.
Good morning to you.
Sorry, thank you. I'm a first-time mom, and I know you've discussed the best sleeping position, but I think I missed the point. So I'd like to know, is it best to sleep? Is it on the right side or on the left side? I'm not sure. Thank you.
Okay, so the sleeping position for pregnant woman, the best sleeping position is on your left side. Why do we say lie on your left side? This is because when you lie on your left side, it gives way for the aorta. The aorta is a blood vessel. All right, let me just say that when you lie on your left side, it gives way for adequate circulation of blood in your body and to your baby too. Yes, so that is why we encourage to lie on either side, but do not lie on your back. At the early stage of pregnancy, maybe first trimester, you may be able to lie on your back, but thereafter, you shouldn't lie on your back. That is because when you lie on your back, the weight of your body and that of the baby you are carrying will rest on the aorta, the blood vessel, the big blood vessel on your body. And this will bring about reduced supply to even you and the baby. Okay? So for the mother, you can actually have what we call supine hypotension. Your blood pressure can drop because you are pressing on that big vessel that aids supply to the whole part of you. So when you lie on your back, it can cause supine hypotension. So please let us not lie on our back. You can lie on either side. That's convenient for you. But the best lying side or lying position is to lie on your left. But of course, you can't lie on your left all through pregnancy. Of course, you can get tired. It will get to a point, it won't be very comfortable. But the best position is to lie on. That's why we encourage, okay, if you are tired on your left, you can actually turn on your right, but not lying on your back. Please, very, very important.
Thank you.
Thank you. I hope you got that.
Yes, I got it. Thank you.
All right. All right. Okay, someone said, good afternoon. Please, I just joined now. Have you talked about the care of the breast? Yes, we have. You can actually get this video also on our site. Every other antenatal classes, apart from today's own, is still on the site. So you can go there, check them out. You see what was discussed. Good afternoon. I have been treating infection and I still have slippery discharge and it is itchy. Please see your gynecologist. Don't self-medicate. This person said, good afternoon, madam. I have been treating infection and I still have slippery discharge and it is itchy. Please, madam, see your doctor. Very, very important. Don't go doing the wrong thing. What do I mean doing the wrong thing? Self-medicating or taking advice from your friend or anybody that feels they know. Please see the person taking care of you. See your doctor. Very, very important. What are the kind of activities to avoid in a placenta previa situation? Oh, when you good afternoon, I get pain in my lower tummy. Try to turn on the other side of the bed. Is this normal and how can this? Okay. This person said, good afternoon, ma. I get pain in my lower tummy whenever I try to turn to the other side of my bed or when I stand up to walk. Is this normal and how can this be managed? Okay, first of all, how old is your pregnancy? Are you close to term? This is actually because of the weight. Remember, as your pregnancy grows, the weight of the baby increases and your tummy also increases in order to accommodate this growing fetus. And because the weight has increased, of course, the skin of the tummy has increased also, and the skin of the tummy stretches in order to accommodate this. So pain, when you want to turn, well, it's normal. So what you do is when you want to turn, try to support your tummy with your hand. Don't just get up and carry the tummy like that by yourself. You should try to support the tummy. Very, very important. Support your tummy as you turn. Always support your tummy as you turn. Then also, when you want to stand up, support your tummy. Please, don't just stand up, leaving the tummy to stand on its own too. This will cause you pain. And when you want to get up, I've seen women, they will just you don't just get up like that with force. This is because your tummy is already stretched. And by the time you do that, it will cause you pain. So when you want to get up from the bed, first of all, you should turn to your side. Then with your hand, support yourself and then gently get up. Not someone lying on your back and you just want to get up like that. That will also cause you pain. So the pain you are having can actually be due to weight of the baby, due to weight of the increasing fetus and the size of the tummy. So that's it. Just do well to support your tummy when lying down. support your tummy with pregnancy pillow. Then when you want to get up, also do well to support your tummy. And also they have this pregnancy girdle. If the pain is too much, you can actually get that. It will also help you. It will help. It will help. Okay, someone said, what is breech pregnancy? And when should one be bothered? What is breech pregnancy? And when should one be bothered? My sister, breech pregnancy simply means that the baby, instead of lying and the head facing down, the baby is lying with the head up. Okay? Baby is lying with the head up and the leg facing down. And also, it could also be that the baby is lying sideways. So please, what you need to do is what exactly your doctor says you should do, or your midwife. Please tell us the effect of. Okay, someone is asking the effect of drinking cold water, whether it is safe or not. Well, to the best of my knowledge, there is no relationship between where the water goes into and where the baby is. The water goes, when you take cold water, it goes straight into your stomach where your food enters. And remember, your baby is in the uterus. So there is no relationship there, and I don't, to the best of my knowledge, I do not see any effect. It doesn't have, there's no effect there. There's no relationship. I understand that, yes, people will tell you, don't take cold water, it will do this. Well, to the best of my knowledge, there is no relationship between that. And I do not, personally do not subscribe to not taking cold water. As a matter of fact, when I was pregnant, if it's not cold, it doesn't satisfy my taste. That's the truth. So please, I think that's just superstitious belief. My chief, you can say something.
No, it's all right. I just think that we should wrap up for the day.
Okay. Okay. Thank you, ma. All right, mothers, thank you for joining me in today's antenatal class. Please do well to always join like you did today, as it will help us in the course of our pregnancy and also prepare us for the care of our baby when they eventually come forth. God bless you. Please stay safe. Take good care of you, and most importantly, your husband too.
Thank you,
right.
doctor.
My husband is the one taking care of me, not me taking care of him this time.
Okay. Don't say that again. I'm not here.
Thank you.
All right.
Can you imagine? He's happy. He's saying thank you.
Yeah, bye-bye.
Thank you.
All right,
Thank
bye.
Thank you so much.
Bye.
Yeah, thank you for joining.
Mhm.